Welcome everyone to the Elmhurst Memorial Hospital Foundation Annual Autumn Affair Virtual Gala. First and foremost, I thank you for your support and patience during the constant change that has occurred through these challenging times of COVID-19. I know it's disappointing not to be in person for this most important event. Our mission at Edward Elmhurst Health is to provide the highest level of safety for our patients, staff, physicians, and community. As you may have heard, there has been an unexpected uptick in COVID cases in our area as we begin what is being described as a winter surge. This was not evident in October when we were coming down from the fall surge. The expectation then was that we would have been in a moderate to low state of transmission, making events such as the Autumn Affair safe and more reasonable to be in person. With that in mind, physician and administrative leadership made the difficult decision to cancel the in-person portion of the Autumn Affair this year. As a foundation trustee, I know this event is one of our most important and impactful of the year, and donors do make an important difference, advancing our priority programs and initiatives. In my role as a physician and a physician leader, my colleagues and I could not justify putting anyone at risk by gathering together in such large numbers during this time. Though I know this virtual format is not ideal, and we would have liked to see all of you in person, we still have a way to go before we are in the clear from a health perspective. And as we head into the holiday season, we want to be sure we are doing our part to keep you and your family safe and healthy. We will need to continue to pivot in differing directions until this pandemic is under control. I thank you all who have logged on to be with us tonight. I hope you are enjoying this event as I am with my family. Thank you again for your support, and I hope to see you all at the Four Seasons next year.
Thank you all for participating in our second virtual Autumn Affair Gala. As you heard from Dr. Sullivan, the current environment poses too many risks for us to be gathering at the Four Seasons. I want to thank him, the chief medical officers, and members of the infection control team and the COVID task force for their due diligence to make this determination. I applaud the organization's unwavering commitment to safety for all of us. But tonight, we are here to offer you the opportunity to be a part of an evening of high impact and to celebrate all that the hospital has accomplished this past year. Throughout the evening, you can help us make an impact on our beneficiary program, which is our nurses. From equipment to tools to educational opportunities, certification, and programs focusing on our nurses' personal wellness, let's see what we can do to support them after all they have gone through over the last year. You'll be hearing more about this initiative in just a bit. In fact, you will hear directly from some of the nurses at Elmhurst Hospital as to what it means for them personally to be in this important role. Before we get to that, I want to thank our sponsors for the evening. Presenting sponsors for the evening include the Elmhurst Clinic, the Elmhurst Memorial Hospital medical staff, and the Julser Company. Our frontline sponsors are Elmhurst Radiologists and Superior Ambulance. And our community sponsors are Lakeside Bank and SEI. We have so many other generous patrons and underwriters. Each of them are appreciated for supporting the foundation tonight. A special thank you to all of those who donated items to the auction. It is amazing the generosity of individuals and companies who have contributed to the event in this special way. Please take time to see what we have on the auction block. Bidding began earlier this week, and we have some really unique items. Our grand auction is not to be missed, so be sure that you take a look at vacations as well as sporting events and food experiences that you can bid on through the rest of this program. The bidding will come to a close at 8 p.m. We will be sharing a video with you shortly, and I encourage you to consider the contribution you would like to make toward advancing our nursing program following the video. I want to thank the foundation staff and the event planning committee for all of their work in bringing all elements of this evening together. I know they were also looking forward to seeing everyone face to face, but they worked really hard to convert this to a virtual format in a short time. Again, thank you all for being a part of this night with us. I appreciate your generous support as you make an investment in the programs and services offered right in our own community at Elmhurst Hospital. Thank you.
Welcome to Autumn Affair, everyone. What an incredible year it has been. We have faced many challenges over the past 20 months, and yet we have accomplished so much. We have successfully executed on our strategic plan while continuing to deal with the COVID pandemic. We have been recognized as a top performer for delivering safe, seamless, and personal care every day. And over the past year, we have received many prestigious awards. Edward Elmhurst Health was recognized by IBM Watson as a top 15 health system for the third year in a row. Elmhurst Hospital was recognized as a top 100 hospital and, in fact, was ranked the #1 large community hospital in the country based on measures of quality, safety, patient experience, and financial efficiencies. And once again, Elmhurst Hospital received Magnet designation for nursing, which places us in an elite category occupied by only 8% of hospitals nationwide. Our patient experience ratings remain best in class. And Elmhurst Hospital just received an A rating for patient safety from the Leapfrog Group, which makes Elmhurst Hospital one of only 23 hospitals in the United States to achieve 20 consecutive straight A ratings since the program began in 2012. I am so proud of all of the healthcare workers at Elmhurst Hospital, our clinics, immediate care centers, ambulatory sites, and physician offices. They have done a tremendous job delivering expert and compassionate care in this challenging environment. I am deeply grateful to all of you for your support of the Elmhurst Memorial Hospital Foundation. And thank you to our donors who have supported this year's Autumn Affair. The generosity of our partners, the community, and all of you allows us to continue to provide exceptional care every day. Enjoy your evening.
Hello. For those of you who don't know me, I'm Dr. Kimberly Derry, Chief Medical Officer and Vice President of Medical Affairs here at Elmhurst Hospital. I also serve on the Board of Trustees for the Elmhurst Memorial Hospital Foundation and as a member of the Physician Champions Committee. I would like to take a moment to share with you a little bit about our nurses from the perspective of a physician and an administrator. Our nurses are truly amazing. They have continued to show tremendous bravery to come in and take care of patients during a very scary and challenging time. They even risked their own health and well-being and made great sacrifices in their personal and family lives during the pandemic. They were strong and they persevered, never wavering in their commitment to their patients. We want them and you to know that their work does not go unnoticed nor unappreciated. We thank them for their compassion and their caring spirit, which is often extended to a patient's family in a variety of meaningful ways. For those of you gathered with us, I am pleased to share a brief video in which you will hear directly from a few of our nurses at Elmhurst Hospital. In their words, you will hear what it means to be a nurse for them personally. It is clear that this is not a vocation, but a calling. And we are so pleased they answered the call. Following the video, I hope you will show your appreciation and gratitude through a gift of support to the foundation. Thank you.
I would describe nurses as intelligent,
empathetic,
compassionate,
amazing,
kind,
essential,
competent,
critical.
I knew I wanted a career where I could use my love of science, be in a people-oriented environment, and collaborate with a team of people. And I decided to pursue nursing, and it was the best decision I've ever made in my life.
I decided to become a nurse because I'm a natural caregiver.
I wanted to do something that mattered to others, and I think nursing is a great avenue for that.
So my whole family's teachers, and I thought that's what I was going to do till I was 16 and had a car accident. Spent 2.5 weeks in the hospital, and I just had really good experiences when I was there, and it really just made me want to go into nursing. I literally switched on a dime after that.
In the second semester of my freshman year, I had emergency surgery. So I was in the hospital for a week. I was most impressed with the nurses. I was so overwhelmed with how kind and compassionate and what a difference they made for me. I changed my major the minute I got back to school.
I knew from a very early age on that I wanted to be a nurse. My mom was a huge inspiration to me. She's been a nurse for Elmhurst Hospital for over 20 years now. She works in critical care, and I just admire and aspire to be just like her.
Growing up, my dad had quite a few medical problems. He was given such good care by the nurses, and I just wanted to give back.
I decided to be a nurse when I was 5 years old. My mom was diagnosed with cancer. They told me that I was going to go visit my mom in the hospital. And when I went, I remember being very overwhelmed because she was hooked up to a lot of equipment and it was an unfamiliar territory. She had one nurse who saw my eyes and covered up the equipment, covered up her arm where the IV was, and put a little pillow for me to sit next to my mom, which is what I would have done at home. And she made my mom as opposed to a patient. And I remember thinking, that's what I want to do when I grow up.
I can tell you as a nurse, unless you've been a nurse, you really have no frame of reference for what nursing is. Nurses have to give their heart in everything that they do.
Yes, it is a wonderful job, but it is nonstop from the time that you get on the floor to the time that you leave.
It's constantly assessing your patient, looking for their needs, not just their medical needs, but their emotional needs, their psychological needs, even their social needs, you know, what's going on at home, maybe that's affecting their care. You're changing your emotions in each room to try to meet where the patient's at.
I always thought being a nurse was giving medicines and taking vitals and taking care of patients and following doctor's orders. I think what I didn't realize is how much of your own critical thinking goes into it, how much you really are the gatekeeper for the patient.
What creates that wow experience for patients and families are sometimes what people consider, little things, and I don't consider them little.
These are big things to me because when a nurse sits down and hears their story, listens to them, when a nurse holds a hand, those are the things that patients and families write to us. It's not about that nurse who started an IV or gave me medications on time. It's all about this caring and compassion that I think makes our hospital unique.
This community is not just made up of Elmhurst residents. We have people that come from all the local areas, but they know they want to come here because they know the consistent respect they're going to have, the consistent safety they're going to experience, and the caring environment that is different from any other hospital around here.
Nursing at Elmhurst Hospital to me is special because it's not just nursing, it's all the staff. It's just a feeling here. I've always felt it through all the years I've been here and in every role I've been in.
The culture is you do what's right by the patients all the time, and you're supported in that endeavor.
I've been here for 20 years. I truly feel that this is home, and my coworkers, they are the ones that keep me coming back year after year, day after day.
My colleagues give 110% to their patients and strive to give them the best care possible. So I look up to them deeply and I strive to give them my all as well.
Teamwork is the center, and through teamwork, it allows us to provide safe and seamless care.
I think the thing that made me the most proud of my teams over the last few years was their adaptability and their bravery.
COVID has truly, I think, transformed nurses, especially here at Elmhurst. We've seen the highest of highs and the lowest of lows.
We came in and our patients needed us, and they were scared, and we were scared, but we had to walk in those rooms and we had to deal with it. We had to just know that this is our job, and we couldn't let our fear stand in the way of us giving care.
Family members couldn't be here, so we were their lifeline. One of my patients' family members via FaceTime asked if I could stay with my patients so they didn't have to die alone. We stayed with our patients. We were with them taking their last breath. That is a moment that truly defined me as a nurse.
She's smiling. Mom!
Our team has been through an incredible crisis over a prolonged period of time that takes a toll on people physically, mentally, and emotionally.
The nursing staff at Elmhurst Memorial is amazing.
To come in and fight every day, show up, do your best, and come back the next day, that is the thing that made me the absolute proudest of my teams.
And so I think moving forward, we're going to have to make sure that we are helping our nurses and all of our employees and the physicians as we together recover from this. We take care of our physical needs, our emotional needs, our spiritual needs.
The most pressing need for Elmhurst Hospital is really an advancement in technology here.
We are updating all the nursing infrastructure in terms of monitoring and technology. Currently, for our nurses, we need to change our IV pumps. We're going to have all brand new IV pumps in. Also, all new monitoring. There's latest in monitoring that will help the nurses diagnose quickly with the doctor what's going on with the patient.
Putting systems in that offer the patient information basically right at their fingertips really puts us on the cutting edge and the forefront of this entire Chicagoland area.
I'm a nurse, down to my bones. My work is tied to my compassion because I was born to do this.
I'm definitely better for all the experiences, the good, the bad, the ugly.
I get to touch the lives of others. It's truly what I've dedicated my life to.
It's my home, it's my family, and it's a place I can make a difference every day.
I hope you are as moved as I am hearing from our nurses. I believe they embody the caring culture that our organization is known for. I want to take a moment to join Lou in acknowledging all of our healthcare workers throughout our hospital and health system. They have been under an amazing amount of pressure to meet the needs of our patients over the last 20 months. They have continued to step up to the plate each and every day to deliver safe, seamless, in personal care. I also want to recognize in particular our nurses in the emergency department, as they have been especially impacted by the current healthcare environment. They can't turn anyone away for care, and we have been experiencing an incredible volume of patients. With staff shortages and a rise in patient visits, the emergency department has been in constant overdrive, and they have continued to perform at a high level. We assume that nurses are always at the ready, mentally and physically prepared to care for our patients during every shift. But as you just heard, even they are human. The day-to-day wear and tear weighs on them has been even more so in this increasingly stressful climate. We know that our patients are tired of the continued restrictions in their daily lives due to the pandemic. They are frustrated, and oftentimes they take it out on our nurses. We also feel the impact of workforce shortages in all areas, of burnout from a health crisis that remains present, and of a changing nursing landscape where some of our top talent is being recruited away. The nursing sector, including here at home, has begun to move away from the concept of home, hospital, and feeling of family that you heard Ricky and Linda speak about. That is why we need to be sure we have the resources to recruit, train, retain, and take care of our people. I would like to thank Linda, Ricky, Jeanette, Jennifer, Brian, Colleen, and our administrative leaders for taking the time to share their perspectives and for demonstrating on a personal level why our nurses are so important. Now I invite you to show your appreciation of all that our nurses and caregivers have done during the most challenging times in recent history and likely in their careers. Our Fund a Need provides you with many levels of support that enhance the overall care and services our nursing staff provides. Your gift of $10,000 helps our nurses save lives with critical service line tools such as defibrillators. Your gift of $7,500 helps us fund the Elmhurst Hospital IV pump conversion project, replacing every IV pump with a new high-performing model that directly impacts nursing and patient needs. $5,000 helps fund equipment like emergency department stretchers that allow nurses to focus on quality of care rather than equipment challenges. And $2,500 supports ongoing nursing education, certification, conference registrations, and continuing education opportunities. If you haven't done so already, please click on the Fund a Need button on your screen below and consider the level of support that you would like to make to advance our program. In the Fund a Need folder, indicate your gift amount by clicking the corresponding button. For those of you interested in making an even greater impact, please see our investor levels. Know that regardless of the size of your gift, every dollar makes a positive impact by supporting our nurses as they continue to deliver the highest level of care to our patients. I ask you to please be generous as you consider making a gift that is meaningful to you. This brings us to the end of our program. I want to sincerely thank all of you who have supported us through the event. If you are participating in the auctions, bidding will be accepted until the close at 8 p.m. Thank you all again for partnering with the foundation. I wish you and your families a safe, healthy, and happy holiday season.